Good afternoon. Thank you for joining us today. I'm Tammy Coleman Epps, and I am the Director of Media Relations and Social Media here at Prisma Health. And I'm excited to be here with you today because we have a great panel of Prisma Health experts, and we're going to talk about brain injury. This month, March, is Brain Injury Awareness Month. It's very important, and we want to just talk with you in general about it because our experts are here to just give you the information you need. As South Carolina's largest healthcare system, we want to make sure we share information with you to try to help you be well. And knowing about brain injuries is one of those things. You might not be aware that according to the Brain Injury Association, there are at least 3.6 million people in the US who sustained a brain injury every year. When I saw that stat, I was like, wow, that's a lot. And I don't know that I was aware of that, and you might not have been either. So I'm pleased to present to you our panel today. So we have Dr. Blake Windsor, who's a physician at Pediatric Pain Medicine. We have Amber Mercado, who is a physical therapist, and we have Jillian Shaughnessy. Look at there, I got it. Shaughnessy. So thank you for everybody joining us today. We're going to start with some questions. If you have any questions on brain injury, you can put them in the chat and we'll try to, in the comments, and we'll try to answer them for you. So thank you. So we're going to start with Dr. Windsor. So let me highlight him. Dr. Windsor, good afternoon.
Hello, thank you for having me.
Thank you for being here. So, Dr. Windsor, what would you say are some of the types of brain injury in case people aren't aware of them?
Yeah, that's a great question. There's a lot of different types and ways to think about brain injury based on what it is that you're trying to, how you're trying to classify them. Sometimes we'll classify brain injuries based on the severity, such as a mild traumatic brain injury, a moderate or severe traumatic brain injury. As an example, a concussion is defined as a mild traumatic brain injury, whereas if someone comes in and they're unconscious and they're not reacting to stimuli, then we would think of it as a moderate or more severe brain injury. Right. Other ways that we might think about brain injuries are on what's happening in the skull and the brain. Is it a concussion? And that's what's happening in the brain, and it was a concussion injury to the brain. Or is there bleeding in the brain? Something called an epidural hematoma or a subdural hematoma, or is there bleeding within the tissue of the brain itself? So there are multiple different types of brain injuries and severities, and all those things matter when we're trying to think about how to treat it and what to expect after the injury.
Good. With that, we're going to ask Amber to add on to that. All right, yeah. Amber, what are the typical causes of brain injury?
Yeah, that was a great description that Dr. Windsor gave. The typical causes that we see, falls account for about 48% of brain injuries, which I always think that's kind of an alarming statistic. Assaults, motor vehicle accidents, those are also common causes. Some of the more atypical ones that you don't really think about whenever you think of brain injury, it could come from a stroke, it could come from what we call like an anoxic or a hypoxic injury, something that would happen like maybe with a near drowning or things of that nature. But I do think that it's important to really realize like falls account for 48% of the brain injuries that we see.
When I saw that stat, I was surprised. I told Dr. Windsor, I was like, we hear so much about concussions, and that's so important too, but falls being such a high percentage that really, I was surprised by that. So with that, we're gonna talk about the most common type of traumatic brain injury. And with that, we're gonna go to Jillian. Jillian.
So the most common type of traumatic brain injury is actually the concussion. And as an athletic trainer, we often see concussions on the sports fields.
Right. So while we're there, Jillian, we could talk a little bit about how we actually treat those while you're on the sports field. So kind of run us through kind of what happens and how do you, as an athletic trainer, help those who've been injured by concussion?
Yes, so immediately if we or a coach notice that a player sustained an impact to their head or to their body that could have caused a concussion, we will get them off the field. That's the most important thing so they don't sustain a second impact. So we get them off of the field onto the sidelines into a safe area, and then we evaluate them using an on-side tool called the SCAT-5, which is the Sports Concussion Assessment Tool. It's the 5th version. And that tool helps assess things like their symptoms, memory problems, coordination, and balance. And based on the scoring of that test, we will, if they do have a concussion or we suspect a concussion, we will send them for further evaluation by a physician.
Well, with that, thank you. I'm going to go to Dr. Windsor because he has a specialty in taking care of people with concussions. So Dr. Windsor, how would you add to what Jillian said about, so Jillian and the team, they prepare, they do the scoring, and then that person shows up at your office. So tell me what happens next.
Oh, okay, goodness. So, so it depends on, when we're seeing like an athlete who's had a concussion, it depends on where they are in their concussion recovery. And that's variable for each person, and it's very unique to each person. Some people, after a concussion, they can turn around and recover in just a matter of a day or two, 3 days. There are certain times of life, the peak duration of concussion symptoms is around high school. And so, and those can often last weeks. For some of our patients, these symptoms will even last for months. So what we do is, just like any acute injury, in the first period, in the first few days, we let somebody rest. Just like if you were to injure your ankle or had another sports injury, you just take it easy. For those few days, let your body heal and recover. And then you slowly start doing more and more over time, letting pain be the guide. So if something is hurting you, if it's bothering you, that means you're doing too much and you need to back off. It doesn't mean do nothing, but you don't want to be overdoing it and causing the symptoms. And over time, these symptoms should fade. But that's where the uniqueness of each person comes in, and we have to come up with an individualized treatment plan based on somebody's unique combination of factors. For the students, which is where we specialize, we have to look at their schooling, difficulties they might be having outside of their concussion that they were having in the days leading up to it. All of these things become very important when we're trying to help someone get back to life. But if somebody is older in life, they're no longer a student, you're thinking about workplace accommodations, you're thinking about manner of things to help somebody function in their life while giving their brain a chance to rest and recover.
Good. Well, thank you. I'm so glad that we have that resource, both our great athletic trainers on the field and our physicians, to try to help people get back to life. That's really important. There's been things in the news about people hit their head. How hard must you hit your head for it to be serious, Dr. Windsor?
That's a great question. And the short answer is it depends. So for a concussion, you actually do not have to hit your head very hard. And in fact, you don't even have to hit your head at all. So for instance, you can have a concussion in a car accident simply from a whiplash incident. With a concussion, what happens is it's related to an acceleration and a deceleration of the brain inside of the skull. And so your head can be moving quickly and then stopping, and you can still experience that concussion without ever hitting the outside of your skull. There's interestingly a little bit of an inverse relationship, that some of the more significant difficulties somebody deals with after a concussion are like the milder injuries are often cause the most prolonged recoveries, which is kind of an interesting phenomenon that we don't fully understand. For a subdural hematoma, which is a different type of injury, not a concussion, where there's bleeding underneath something called the dura mater, one of the protective linings around the brain. For this one, if somebody's on a blood thinner, for instance, say they're older and they've had a history of a blood clot, or their brain has had some shrinking, if there's a little dementia or things like that, it really does not require much of an injury at all. It could be something as mild as, bumping your head getting into a car, or slipping and falling and hitting the back of your head. If it's an epidural hematoma, those tend to occur with bigger impacts, such as a fall from a moving vehicle, or a fall while skiing, or something like that, hitting typically the side of your head and breaking some blood vessels there to cause bleeding outside of that protective lining. So again, when we're talking about bleeding, if somebody's on a blood thinning agent, you do not have to hit it very hard at all. But it depends on other risk factors such as their age and the type of injury as to how hard that you have to hit it and what type of injury you will experience.
Good, thank you. With that, we're going to go to Amber. Amber, we've been talking about falls. I mean, I know you take care of lots of people who've had falls to try to help them get back to life. So what kind of recommendations do you usually make when you're dealing with someone who's had a brain injury due to a fall?
Yeah, so I think one of the things that we try to educate people on is that the best predictor of future falls is actually past falls or history of falls. So if you think that you or someone you love is at an increased risk for falls, or if they've had falls, I think being proactive is the best thing that you can do. And I always tell people it doesn't hurt to go through an evaluation. There's multiple disciplines in the rehab setting, whether they need speech therapy or occupational therapy or physical therapy. It's all very customizable to what the patient's having trouble with. I think it's better to be safe than sorry in those instances and be proactive, depending on kind of what the complaints are. I also think, obviously as we get older, unfortunately, the risk for falls inevitably goes up. So that's another thing to kind of be aware of. And, we have lots of tools to treat, a wide range of symptoms. It could be as simple as making recommendations for an assistive device, or making recommendations to rearrange your home in a safer way, removing obstacles, increasing light, because vision plays a big role in our balance and fall risk the older we get. But it could also be maybe you need a formal plan of care to kind of address weakness or imbalance or endurance, vision therapy. There's a wide spectrum to kind of address those things.
Good. With that, we're going to go back to Jillian. Jillian, I know that we talked about a little bit about concussions on the field and how you do the scoring. Are you seeing more concussions now on the field as you're taking care of young athletes?
So I'm not sure if it's more or if it's just that people are more aware of concussions. I believe over the years, although there could always be more public education on this topic, education has increased, and athletic trainers are encouraged to talk to teams before season start, like football teams mainly, and educate the coaches and the student athletes on symptoms of a concussion. So when they happen, they can report them to a healthcare provider. But either way, concussions are very prevalent, not just in football, but also other sports like women's soccer and basketball even.
Oh, good. I think that's important that we are doing a better job on education, because I know that we have seen some cases where that hasn't happened. We're going to go to Amber. All right, Amber, so the question is related to how you as a caregiver or a person who has somebody in your home who's had a brain injury, how can you assist them? We want to be good stewards and friends and family members, and we're thinking like, what can I do to help?
Yeah, that's a great question. So I think, again, knowledge is power. And I think, learning as much as you can to be your own or your loved one's advocate. Sometimes it can be difficult to navigate the medical system and know all the resources available, especially if you're kind of not familiar with it, or you're not in the medical field, or you don't have that prior experience. So I would just tell people to educate themselves, reach out to, there's a lot of community resources, find providers that you trust, and use them as a tool to help you kind of make decisions going forward.
Right, you talked a little bit earlier about some of the things that we do to try to help people with falls. What about other recovery from other brain injuries that might not be related to a fall?
Yeah, so I think Dr. Windsor touched on it earlier. If it's not a fall, brain injury rehab covers a very large spectrum. A lot of it depends on the severity of the injury. But the things that we would address from a rehab standpoint, it could be memory, it could be oculomotor tracking, so how your eyes are working and moving together. It could be your reaction time. It could be, weakness. It could be imbalance. It could be your endurance. It could be, like I said, making recommendations. Some people need equipment to, be as independent as they possibly can at home. So that's a big part of how we educate patients.
Yeah, I'm going to go to Dr. Windsor to see if he wanted to add anything to that. Dr. Windsor, did you have anything to add to that about recovery from brain injuries?
Sure. So it just depends, like Amber was saying, it just depends on the type of injury as to how you're going to treat it. It also depends on your age. So for instance, the young brain is very, it recovers, right? So we in healthcare have seen all sorts of people who've had like the worst brain injury you can imagine, who have, when you look at them, you say, I could never tell that they had this awful thing happen when they were a baby, for instance, because the brain is so able to recover. Now, as you get older in life, it's harder for the whole body, including the brain, to recover the same way. So it just depends. If somebody had a mild traumatic brain injury, we generally expect there to be a full and complete recovery. We want to help guide them through that recovery, because even though it's considered a mild injury, anyone who's ever experienced a concussion would say there's nothing mild about what they went through. It can be very disruptive to their life, very disruptive. More moderate to severe brain injuries, sometimes we're trying to just find what's going to be their new normal and say, you had this event, now we need to see, what kind of career or work are you going to have in the future? What are the things that you're able to do? How do we understand, how do we give you the recovery we can get you, but also recognize you might not have made a complete recovery? And like Amber was saying, families equipping themselves with knowledge to understand really helps with patience and coaching and encouragement and all these things that are incredibly important whenever someone's making a recovery. And the last thing I'd like to add is that in all things with brain injury, prevention is the best treatment. So it's incredibly important that athletes wear helmets when able, that when people are riding bikes, that they're using proper safety equipment, because recognizing that our brains are everything, and so we need to really protect them is the most important thing that a family can do for their loved ones, is to encourage them to take care of their brains.
Good deal. I was going to go to Jillian. I think she had some other things that we were talking about for prevention. Jillian? I know there was a list of things about how to prevent brain injuries. I know Dr. Windsor touched on some of them. I think there's a few others maybe.
Yes, so specifically for kids, you can make sure that you are following the national safety precautions for buckling kids into car seats and safety seats. And in addition to wearing helmets while you're riding bikes, you can also wear other protective gear and make sure that you are riding and playing in safe areas out of the street, out of the way from cars and other things that could harm you. Also, make sure that your child or an older adult or someone who has balance problems is living and working in a safe space. So if you're watching children, make sure that they stay off of elevated surfaces. If you're living with an older adult, make sure that the carpets are stuck down, make sure that there's no tripping hazards, and also make sure that they get their eyes checked. Vision is really important in preventing falls, so get your annual eye exam and keep up with your glasses. And those are the tips that I can think of off the top of my head.
Good deal. Thank you. So now we're going to just go back to all of you since you're talking. Jillian, I'll give you a final thought. So we'll go back to Jillian, then Amber, and then Dr. Windsor for final thoughts. So Brain Injury Awareness Month, Jillian, final thoughts.
So from my perspective as an athletic trainer, first, I want to just remind everyone about prevention. In the sports area, prevention is the most important thing. So make sure if you're a football player, you are using safe tackling techniques, and make sure that your helmet fits appropriately. Make sure you tell somebody if you are experiencing symptoms of a concussion. Other than prevention, I just want everyone to know that we can make a really great team here at Prisma Health, working with you and your families and your school to make sure that you can recover in the classroom and on the sports field.
Wonderful, thank you. We'll go to Amber. Amber, final thoughts.
Yeah, I'll just reiterate what Jillian and Dr. Windsor said about prevention being key, being proactive, and in the event that, you know, you or your loved one does acquire a brain injury, we have an awesome multidisciplinary team here at Prisma, and we really like to take that approach. We think that's the best thing for the patient. And then as far as for the family goes, I think, you know, on the more moderate to severe side, just, you know, celebrating even the small victories. You know, the whole goal is to give the patient, you know, as close to prior level of function as possible, the most independence, the highest quality of life. So, you know, that there's a wide range of things that that can look like. So,
All right, Dr. Windsor.
I think we've covered most of it. I think I would just say that if prevention is never 100%. So if a brain injury does occur, just to say that, there are things that we can do to help. My colleagues in the rehabilitation fields are really excellent at what they can do, especially in the realm of concussion, where I tend to specialize. That there are lots and lots of different treatments that have come out over the past 10 to 15 years around concussion and helping people get back to their pre-injury life.
Good deal. Thank you. Thank you so much. Thank you for joining us today. If you have any additional questions, please put them in the comments and we'll try to answer. We appreciate our experts from Prisma Health. I think they said it well, that we have a multidisciplinary team ready to help you if you need us. We'd like for you to use some of those prevention steps so that you don't, but otherwise, thank you for joining us today, and we hope that everyone has a great day. Thank you.
thank you.